Good evening, everyone. Good evening. Good evening. Thank you for joining us for our August edition of the Mental Health Power Hour. I am your moderator. My name is Donald Mitchell, member of the Omicron Sigma chapter, also known as the North Dallas Sigmas. And tonight we got some heat, some fire, some thunder, whatever you want to call it, because it's going to all apply. First off, we have one Dr. Tamika Perry. She specializes in osteopathic medicine and family medicine. And if you couldn't already tell, she is a devastating diva of Delta Sigma Theta Sorority Incorporated. Dr. Perry, thank you for joining us tonight.
Thank you for having me. It's a pleasure to be back times two. So hopefully you guys will invite me back next year again.
I mean, listen, you got the family cookout invite. You know, you just
Yeah,
you want to show up, and we gonna let you roll through. You already know what
I
this is.
appreciate it.
Absolutely. And the other panelist that's going to give us this education tonight is brother Pastor Anthony Harris Sr., who is a licensed clinical social worker and a member of the Phi Beta Sigma Fraternity Incorporated. Brother Harris, welcome.
Well, thank you very much. I appreciate the invite. I'm around some good brothers and some good sisters. I'm glad to be here. Glad to be here. Go Mob.
Go Mob. And also let me shout out that he is the uncle to one Demario Harris, member of the Omicron Sigma chapter. So, Brother Harris, thank you for
That's
putting
right.
us in touch with Brother Harris. We appreciate it.
Absolutely.
All right, so I'm gonna go ahead and get this party started. We got, like I said, it's gonna be just a conversation. Y'all talk to us, we're gonna talk to you. Um, People, guests, put your questions in the chat. We'll try to get to each and every one of them. But I know this is going to be something very educational, something very astounding, something just a all love going forward. So, with that said, I'm gonna start with Dr. Perry. Question for you:
Sure.
How do you distinguish between healthy and unhealthy anger?
Oh, that's a great question. So the other thing about healthy anger is, and let me just digress and start by saying anger is a normal human emotion, right?
Okay.
We all, if you're devoid of anger, then I'm a little bit afraid. All right. So it's a normal human emotion. But healthy anger is proportionate to the situation. It's brief. There's a pinpoint of a trigger. Unhealthy is disproportionate to the situation. Somebody cuts you off in traffic, you pull a gun on them. That's a little disproportionate, right? Maybe a hand gesture might have been proportionate, but pulling the gun is
Okay.
disproportionate. Okay, right?
So you're
Right.
saying hand gesture. So if I do something
Yeah,
inappropriate, it's got to be something small like a hand gesture.
right. Disproportionate. So
Gotcha. Okay.
disproportionate. There is mental aggression. There is physical aggression that may be associated with anger that is unhealthy. Right. You're harming not only yourself, but you may be harming others. There's a difference between healthy, normal human emotion and going beyond, above and beyond the call of duty.
Okay. Thank you, ma'am. Thank you. So guests, please know that the good doctor says that if you are going to have anger, make it small, especially if you're
Make
driving.
make it small. And another thing about unhealthy is there's this chronic resentment. You know, at some point you say, I have to get over this. But you ever known people who are consumed by a situation that's associated with
Mhm.
unhealthy anger? This
Okay.
chronic resentment. You
Okay.
know, your girl cheated on you when you was 15, you're 45 now. It's not,
Oh,
get over
you
it.
should be like Keisha Cole and let it go.
Let it
Yes,
go. Let
I
it
agree
go.
with you.
Let it go.
Brother
That's how crime.
Harris.
That's right. Hey, that's how crimes of passion happen.
Yee. It's
Yeah.
a thin line between love and hate.
Mhm.
Brother Harris,
Yes, sir.
question is yours, sir. How do you distinguish between healthy and unhealthy anger?
Well, I actually agree. There's some healthy anger in itself is not bad emotion. It's not bad. It's needed. We actually need anger because it can stay out of trouble, or at least it can help to protect us when trouble arises and certain kinds of situations. And as Dr. Perry was saying, there's that healthy side where it's appropriate to get angry about certain things because it can help protect you and others around you, and can help you to correct certain things that's going on in your life, or certain things going on around you. And at the same time, there's that unhealthy anger, as she was talking about, that is just disproportionate to what's going on, and that's really where the main issues come in. That unhealthy types of anger that's more destructive than constructive.
Okay, okay, constructive versus destructive. That is a whole question in itself. I won't ask it, but that is a whole question in itself. Like, and if I was to ask this question, and I'm not going to, but if I was, I would ask, what could be the fine line between constructive and destructive? But we're not gonna go there. I'm gonna try to stick to the script tonight. Try. Um, but I will ask this though. So, do you think anger is a learned behavior, Brother Harris?
Well, it's a natural. It's natural, but the way we express it can absolutely be learned based on our experiences, based on our culture, based upon certain, social skills that we're taught by our parents, or just they're simple examples of how they handle anger or handle certain situations. So yeah, it can be. It's natural. It's natural to get angry,
Mhm.
but the way that we express it, many of those are just that's learned. Those are learned behaviors.
Okay. Okay. Thank you for that. Thank you for that. So you are saying that even though the emotion itself is inherent to people, but how they express it could be a learned behavior. Is that what I'm hearing?
Yeah, yeah, absolutely. Because again, they're like the healthy and the unhealthy. Excuse me. The healthy and the unhealthy anger. Again, see, I even think of it in terms of the unhealthy kinds of anger are more reactionary, whereas the healthier kinds of anger are more responsive, which means that we're dealing more with an emotional expression versus a logical expression when it comes to that which is healthy versus unhealthy. And this is where a lot of people get themselves into trouble, is when it's
Mhm.
more reactionary than it is responsive. And this is where we get the word responsible, or the ability to respond to whatever's going on in that particular situation, rather than just reacting with that's when I'm up and bad things happen. We react to our anger rather than responding to what the situation presents to us, rather than our emotions. So the logical side of anger is more constructive than the emotional reactionary side of the anger.
And there he goes with those big words, right?
He see, he just won't act right.
He won't act right. But
But
you
Dr.
asked
Perry,
about,
I'm gonna slide this question to you though.
yeah.
So, do you think that anger is a learned behavior?
So I agree with my colleague when anger is a natural behavior, but the way you express anger is learned. And if we think about it on a big national cultural level, just think about the way we as Black folks parent our children. We are stern when we
Mhm.
parent them, right? We ain't taking no mess. You ain't calling me out my name. And we are stern believers in corporal punishment. When children are around, they are not heard, they are only seen, and they better act accordingly. But who parented us for hundreds of years when we came to this country? The slave master. And what did they do? They beat us. We didn't look directly in their eye. And I'm not saying our parenting style is bad, because, as God is my witness, the one that I shared a body with will not talk bad to me. However, we have to think about, what are these learned behaviors, right? So these, in the same way, how do we express the way we parent? How do we express our emotions is a learned thing. So if you're in a household where there is a lot of yelling and screaming, that child is going to yell and scream a lot. That child is going to express themselves in a yelling and screaming manner. I have a first cousin, and I think she may be on the call, but she is the calmest person in the world. All of her children are calm. However, comma, me and my daughter are more like, you know what I mean? So we,
Turn up. Turn up.
yeah, yeah, we express ourselves in a different way. And then why? That's because that's a learned behavior. My aunt, her mother is very calm. My mother is more of a boisterous, verbose, um, you gonna know what she gotta say type person.
Mhm.
So do we both feel anger? Absolutely. Do we both feel sadness? Absolutely. But our expression of it was learned.
Okay. That makes perfect sense to me. And so there's a couple of things that I wanted to touch on, one from you and one from Brother Harris. So with you, you mentioned that our learning behavior of how we parented was, not just inherited from a direct, immediate upbringing, but from centuries and centuries of
Mhm.
how our ancestors were treated. And so they
Exactly.
just
Mhm.
they taught in the way that they knew how, and it just went from generation to generation. And to Brother Harris's point, he mentioned, reactionary, basing your anger off of emotion. And one of the things I always try to tell people is don't make decisions based on your emotions, because it never will end well for you. um I when he said that, that was the first thing that came to mind. So I was like, oh, I got to put that out there. But I do have a question for you, Dr. Harris, and I think that you will really like this one. Do you think angry people are completely responsible for their anger management issues?
Are you talking to
Do
me?
I believe that
Okay.
people? I'm sorry.
Dr. Perry.
That question was for me.
Oh, I'm sorry,
Yes, ma'am.
Dr. Perry.
Okay,
Dr.
so
Perry. Yes, ma'am.
do I think people that do I think they're responsible for treating their anger, or do I think they're responsible, like, why are they angry?
Do you, let's go with both. Yes.
Okay, so let's go with the first one. It depends on the situation, but let's look at us culturally as a whole. Anger can be, and I'm sure my colleague will agree, is a response to, like he said earlier, perceived or real disrespect, injustices, um, upbringing, social economic status. So if you have an individual who is systemically oppressed all the time, can you fault them for being angry? Right? People call us as Black women angry Black women. I mean, those are the adjectives that come before our name, right? And you say, why? Why is this happening to us? It's because we have been systemically oppressed, and this is our expression of it. So, are we at fault for that? I think it depends on the situation. But if you're talking about us in particular, no. And in society, will give us diagnosis for this too. But we can talk about that later. We ask me, and we'll talk about it. But I'm gonna let my colleague answer.
Brother Harris, what's your thoughts on that? Do you think angry people are completely responsible for their anger management issues?
Yeah, no, absolutely. Dr. Perry hit on a lot of great points regarding what has happened and what has occurred within the African American community for the past, few hundred years, at least here in the United States, and that does play a role. Unfortunately, we have still this very unsure, reactions, if you will, from a social standpoint regarding like racism and all the different other things, the post traumatic slave disorder and slave syndrome and those kinds of things in terms of, hey, y'all just need to get over it. I understand that to a degree. I understand that to a degree. But however, when you're, as Dr. Perry was saying, these many years, all of these things happening, and all of a sudden now you say, well, we just get over it. But then there's a lot that we do have to address. We do take responsibility for our own selves, but there's also a necessity to really understand the origins of this anger and why these things keep creeping up generation after generation after generation. And so, when we're talking about, because absolutely and obviously, culture and history plays a large role in the in the anger issues that many of us have. Now, I'm also a big proponent of taking personal responsibility. However, we cannot just say that this doesn't matter anymore, that we just need to just get over it. I understand the concept, but you can't just get over it unless there's way more.
Oh, we lost Brother Harris. So
He'll be back, but that's okay. I can pick up where my colleague left off.
go right ahead, Dr.
So I can definitely pick up. No, where he was going with this, yes, we have to take personal responsibility and personal onus, but there is an implicit entity that happens within us as Black folks, right? So years of us not having access to education, healthcare, our family being broken up in the 60s where the gentlemen can live with their wives in the housing projects. So you've disrupted the family, right? Now you have these young brothers who are growing up without fathers. You have testosterone raging in them. They want to make a better life for themselves, but they don't have the opportunities like everybody else. And then when they go out and do things that are deemed not societally accepted, you're asking yourself why. And the oppressive guilt will give you diagnosis, and that's just Tamika's opinion. The oppressive guilt will give you diagnosis of things like oppositional defiant disorder. Is it real? Is it not real? It's not like I can do a blood test for it. But what oppositional defiant disorder is an ongoing anger, defiance against authority. And ironically, Blacks are more likely to be Black children are more likely to be diagnosed with oppositional defiant disorder, but white children are more likely to be diagnosed with ADHD. So they have an attention problem. We're mad. And you've given a diagnosis to it. Ironically, approximately 40% of individuals who are incarcerated, male or female, have a documented mental diagnosis. I'm not here to argue whether that mental diagnosis is valid or not, but it's documented. And what do the people who are incarcerated look like?
Not us.
So what I'm trying to say is that, is it that everyone in jail has a mental diagnosis, or has societally, systemically, implicitly made them angry, made them have that situation? Just food for thought.
Those are things to think about.
Just food for thought. Even there's a diagnosis called intermittent explosive disorder, where you just mad for you blow up out of proportion. And when you look at these diagnoses, antisocial personality disorder, intermittent explosive disorder, oppositional defiant disorder, these are real, like in the diagnostic statistical manual of mental disorders. When you look in there, like this can be written down on your chart, words like urbanism.
So basically,
are used.
Being defined by where you live? Is that what I'm hearing?
Who lives in urban areas?
I was trying to be PC about that question.
So low socioeconomic status. You know, they will beat around the bush, but when you look at the actual patients who have these, they look like my offspring and your offspring. That's just something to think about. So we're talking about anger here. And as a medical doctor, you guys asked me to come on, how does anger intertwine with these diagnoses? Now you've put a label on a person because society has made them mad. You gave them a diagnosis. Really, society made them angry, but because you couldn't accept that or didn't recognize it, you gave this person a diagnosis. Now, what is that implication for? Now, how does that imply for the rest of that person's life? And does that person start to believe that there is something wrong with me? That's why I'm behaving this way. Not because your dad wasn't at home because the government said that he couldn't live with your mama or your mama couldn't get public assistance. Not because you were denied access to adequate health care, not because you were denied access to adequate education. Oh no, wait, what am I saying? Those are the exact reasons why. Those are the exact reasons why that person is angry. We're not talking about I got mad because, you know, my coworker ate my lunch. We're talking about.
I'd be mad at that too, though. Let's be real.
I am too, because my lunch be good. So
let's be real.
Yes,
I'd be mad.
I think Mr. Harris is back.
Brother Harris, are you back with us, sir?
I hope I get to stay, because you know I was gonna say yeah. Everything Dr. said, I was gonna say yeah. That's right. Yeah, that's right. No, but she's definitely hitting on a lot of points regarding those particular diagnoses. Those things will follow you. And she talked about the intermittent explosive disorder and the opposition defiant disorder, and even a conduct disorder, which, from a clinical standpoint, once a person becomes 18 and above, then those diagnoses now become antisocial personality disorder and different other of those kinds of disorders, in which yeah, those labels will follow you. And one other thing I like to kind of address as well is uh, for for many African Americans, since we're here with men, I'm gonna talk a little bit more about men and depression. But how we talk, since we're talking about anger, how one of the symptoms of depression is irritability, but irritability shown from a man can look like anger, and so now what we'll do, however, instead of properly diagnosing someone with, let's, for example, with depression, what we'll do is we'll try to send them to anger management classes. I don't have a problem with anger management classes, that's fine. But when we do that, sometimes we fail to actually understand the real issue, which may be associated with depression. So now, instead of um, referring someone to therapy, we refer them to a court, we refer them to the legal system in order to get themselves taken care of, rather than getting the mental health help that is actually needed. So the anger issue is a big deal, especially in the African American community and in the community as men are concerned as well. But because there isn't a push to
Right.
really gain an understanding from a male point of view, then we're having these kinds of issues where we're just slapping labels on everybody without really getting to the real root of.
Mm.
So I just want to kind of piggyback off of what he said. You know, in this
Wow.
society, and I think Mr. Harris went out again, Brother Harris went out again, but in this society, we are young men are taught that, you know, don't cry, suck it up. So
Yep.
the expression of emotion is different, especially for things like depression, because depression, you typically think someone is sad, they're crying, they're down, they have anhedonia, which is that's the inability to do things that you normally know you should do or give you pleasure. You know, they just do it. But the expression of depression, he's on spot on in a man may be anger, it may be physical aggression. And a lot of times when these and depression is a diagnosis, it's a little different than the other ones I talked about. So the other ones I talked about, like there's no like it's really subjective. It's not objective, right? There's no measure for it.
Absolutely.
But with depression, even though there's not a blood test, you can actually look at brain scans. You could measure serotonin, dopamine levels in your brain and see how they're depressed in people with depression, how they're lower. So there is a physiologic, like we can reach out and touch it type reason, right? So when you have these diagnoses, and even if we say oppositional defiant is real, IED, intermittent explosive diagnosis, if I were to accept that is real, and I'm not saying that it's not, I'm just saying things we should think about. Why are we putting people in prison for an expression of their disease state? Would you put me in jail for diabetes or would you treat the disease state? See, if you're going to give me a diagnosis, what is my treatment?
And it's funny that you mentioned that because that is the perfect segue for the next question I have had on my. I've been itching to ask this question because both you and Brother Harris touched on this, and I was like, well, if they're gonna give me if they're gonna throw me the oop, I'm just gonna dunk this thing. Y'all just gonna set this up for me. So here we go. What are some techniques people can learn in therapy to deal with anger management?
Well, it's since Brother Harris has his area of expertise. If he's not back on, I'll definitely
He
go
is
for
on
it.
here, Brother Harris. She's gonna slide you the mic. Let's go.
All right, all right. You know what? I'm gonna say this because I'm a believer in uh, anger, actually, what we call primary and secondary emotions. And I'm a believer in anger being a secondary emotion. In other words, anger is not really the first thing that we feel. Primary
Okay.
emotions are those emotions that we feel, maybe sadness or maybe embarrassment or what have you, maybe even disrespect or devalue, because those are some of the feelings that many African Americans may feel, the disrespect, which has to do with being devalued, embarrassed, or those kinds of issues. And so when we're dealing with anger management, one of the things, or anger, I should say, one of the things that what I like to do is I like to explore primary emotions before even dealing with the anger so that we can kind of get to the root of what's really causing all of this anger to happen. For an example, if in the African American community, we have a tendency to use the term disrespected a lot. Matter of
Mhm,
fact, there are many people
mhm.
imprisoned
Yeah.
who will probably use that term or use that word, I was disrespected, which really they're really saying I was devalued. You devalued me, and I did not really know how to get that value back. So what I did was I got angry because not because of what you did, I got angry because I was devalued. I was
Mm,
devalued because of what you did. So now what I want to do is I want to get my value back. So what I'm going to do is I'm going to punch you in the face. I'm going to curse you out. And I'm going to destroy some property. I'm going to do all these different things to get my value back. So what I like to do, instead of just going straight for anger management, which is good to do, but what I like to do is I like to get more to the root of the anger, which could be, in this case, we'll just say disrespect, but it could be anything. It could be rejection, it can be
Mhm.
abandonment, it could be neglect, it could be several other excuse me, several other of those kinds of emotions that we now begin to strengthen within
mhm.
that individual, which will then in turn begin to decrease the anger as we continue to teach about anger and those primary emotions as well. So that's just kind of how I like to start, is to actually dig a little bit deeper into some of those primary emotions to really start dealing with anger.
Okay. So Dr. Perry, I'm a adjust your question just a little bit. Sim-
Please do, because I give bad advice when it comes to anger. That's why I send to people like Mr. Harris, because I think initially I'll be like, "Girl, put sugar in this gas tank." I mean, let me refer you to counseling. You know what I mean? So yes, yes.
I want to strike that from the record. Dr. Perry did not say that to the ladies on the
she
call.
ain't
He
she
did
ain't
not
say
give this as
that.
advice. Let's just say, ladies, he did not offer that as advice as a medical doctor. So, Dr. Perry,
Uh,
what I would like to ask you is that
Absolutely.
how if you have a patient that
Hmm.
you can tell is having a bit of an anger
Hmm.
concern. I won't call it
Hmm.
an issue, we'll call it an anger concern.
Right.
How would you best recommend for them to work on those concerns?
So anger, like my colleague Mr. Harris said, anger in itself, I'm looking for root causes or comorbid conditions, meaning what else is going along with that? Is it anxiety? Is it depression? Is this really an expression of depression? And if it's just anger, I usually do refer to counseling. And in counseling, not only are the techniques that Mr. Harris talked about, there's meditation, there's mindfulness, there's breathing techniques, there is I statements that you use, and that goes back for when you're angry and you're talking to someone and someone's talking to you, these I statements like, I understand what you're saying, I
Mm,
give me a minute to fall back. And these are techniques that you learn in therapy, right? Now, if there are comorbid conditions like anxiety and depression that we talked about earlier, they have more aura organic, so that anxiety can be that fight or flight situation. So when you
mm,
become anxious or even angry, right, there's a surge of adrenaline, or in medicine we call it epinephrine. So you're either going to fight or you're going to flight. Either way, you have an increase in heart palpitations. You have, blood is diverted from your gut to your muscles. Your pupils are dilating because your body has systemically sensed that I am in danger,
mm,
right? My
mhm.
mental well being is in danger. So if it has that component to it, not only will I do counseling, I may, depending on the situation, do medication that addresses those, that dampens that fight or flight, that increases that serotonin if it's depression. But it all depends on the situation. But my first inclination, what we're taught first, is always refer to like Mr. Harris.
Mm. Okay. Okay. I love the the commingling and the handoffs, right? It's, you know, I love the fact that you as a medical doctor recognize that's not my expertise. Let
Right.
me give you to someone who can help you
Right.
rather
Right.
than being like,
Absolutely.
oh, well, I already see this is where I need to go. So here, let me write this script, go on to your
Right.
local, you know,
Mm-mm.
go to your local Target or your local CVS and fill this out. You feel better.
Because
That
you gotta, you're absolutely right, because you gotta understand, like Brother Harris was talking about earlier, what was the root cause of the anger. So I can't just medicate that, because when you stop
sure.
taking the medicine, it's still there. And medicines are not benign. You can become water toxic. So things are
Uh-huh.
not benign, right? So the
Absolutely.
root cause is still there. I've medicated you. Some of these medicines have addictive properties. That's not doing anybody any good.
But there are several people out there who would do just what you said.
Oh, absolutely.
And
Absolutely.
it's tragic that they would, but they do. So
Absolutely.
um okay, let me ask you this then. Do you in your experiences, and this may you may or may not have gone to this through this rather a lot, but do you think that children experience the same type of anger as adults?
So I think they experience the same type. I think their expression of the anger is different, if that's what you're asking.
Sure,
So
let's go with
they,
that.
they may throw tantrums, they may kick, they may bite, they may give you the silent treatment, they may cry. And that's because, like, the executive functioning, and when I say that, means the frontal lobe where our emotions and personality are in our brain. When I did that, I felt like I'm pointing out my big forehead. That's because I'm smart, y'all. So,
Yeah.
Don't
so
worry, we were not looking at you
I'm
highlighting
smart. That's why.
your frontal lobe. That's what we'll call it.
Right. So that's where that all matures and develops. But that doesn't start to mature or develop until late teens, early 20s. There's a reason why the draft was at 18, because an 18-year-old male believes that he is invincible. He can do anything. And if you, in any given situation, I may act angry and shoot the opposition. And there's also a reason why that at a certain age they said kids can't go to adult jails. They got to be tried as a child, because they don't have the executive functioning to distinguish that right wrong as adults do. The brain just isn't developed like that yet.
Although to be fair, some adults will act the same as children, but I'll leave that there.
Very fair.
Brother Harris. So I'm gonna alter your question just a little bit due to you. Hey, where'd he go? Okay, or not. Um, well, I will hold that question for when he comes back. So I'm gonna ask you this then, good doctor.
Okay.
What in your experience have you noticed are common anger triggers rather?
I'm here, man. I don't know what is going on. I don't know what is going on with my device here.
Well, pause it, Dr. Perry. I'm gonna come right back to you.
Okay.
Brother Harris, so
Yes.
I'm gonna alter the question just a little bit based on your experiences. Have you seen that children can express the same type of anger as adults?
Yeah, yeah. Well, as Dr. Harris said, anger is real. Anger is real. How to express it can be different. And as she was talking about the the development of the brain, and just the lack of education as to how to handle anger, even for many of our kids. And I'm not because they just are kids. I mean, just about a lot of kids haven't really been taught the social skills as to how to handle angry situations. Because for many of us, we see our parents do behave in a certain way when they're angry about something, what have you else, and so they get angry about the same things, but again, that expression is quite different.
Mhm.
And with
It may be weather. I think, yeah, it may be weather for
He's about to
him.
drop us something stupid. I know he was. He was about to just like take everybody out. Um, so I will offer this. I will say that as someone who grew up in oh, there he goes.
I, I don't know what's happening here, but anyway, for many of us, these are the examples for many of us have seen. Now, obviously, this is not the African American, lot of obviously great families in the African community, but this is how we are being raised even on today, that this
Yeah.
is how we handle certain situations is through anger and not necessarily through social skills. We see it through what do you call it, the housewives of Atlanta and the housewives of this and the medical doctor women and all these shows that we see where there is no conflict resolution being taught, being learned by our children. And so now they believe that they can, that's how you get stuff, is by throwing glasses and jumping over tables
Yeah.
and all that other kind of stuff. So um so yeah, how the doc was hitting, Dr. Perry was hitting on these the social aspect of things as well.
I would like to also offer that, as many of us can probably attest to, when we were growing up, we were taught that, they didn't raise no punks. I'll just
Mhm.
I'll just be completely transparent here. I didn't raise no punks, so
Yeah,
go swing, go
Mhm.
fight, and
Mhm.
don't lose.
Mhm.
That was the big one.
mhm,
So to your point, Brother Harris, not just not learning social skills, but learning negative conflict resolution was
absolutely.
what we learned and what we knew. But I'll leave that there though.
And once again, we have to go back to, where did we learn this from?
Absolutely.
Where,
Absolutely.
where did
Right.
this come from? Just a short anecdotal story. A few years ago, I went to South Africa and we were in this class where we learned about different African tribes. And there's this tribe called the Petty tribe. And what they do is when the
Wait, did you
boys,
say petty as in Petty?
that would be my tribe, but it was
Oh,
PEDI.
oh, okay. Okay. I just
Yeah.
want to make sure. Listen, I had to
Yeah,
make sure that
that's the
I
tribe I
had to
belong
make
to
sure that
now.
the people knew what we were talking.
So at about 13 or 14, all the boys, they take all the boys and they go live communally with the elders, and the elders teach them how to make a living, how to be a husband, how to care for your family, conflict resolution. And so I say that because my tour guide asked me, he says, he was a mulatto in South Africa, and he asked me, he said, what I don't understand is, why is your music so angry, disrespectful towards women, et cetera, et cetera. I said, you got to understand that we're a culture in our infancy. We're only 150 years post slavery. We don't have, nobody takes our boys into a communal tent or communal living to teach them the ways of society. We're trying to navigate this ourselves. And what's been superimposed on us, what was taught to us by our oppressors, was still being taught to us by our oppressors in administration. Oh, God, I'm sorry, I didn't mean to say that. But it's still being taught to us by our oppressors now.
Oh, my bad. You didn't see that. Um, yes, I agree with everything that you just said, and I'm not going to okay. I'm gonna just ask you to pass around your collection plate after this, virtually or physically, however you want to. We just gonna drop something in there. Okay, so I'm going to deviate from the questions, and I'm going to ask a question that one of our guests asked.
Okay.
So Dr. Perry, I'll start with you. So you mentioned that it's normal to feel anger.
Mhm.
If you are expressing shock, disappointment, or dissatisfaction with someone's behavior, how can you effectively communicate displeasure without allowing the conversation to be derailed or deflected to a discussion about tone, energy, or attitude?
So that was an excellent, well thought out question. So one of the things you have to do is, sometimes we may have to temporarily exit the scene. Think about what you want to say. Think about how you want to reflect towards
Yeah.
that person, and really think about not only your position in the conversation, but try to put yourself in the other person's position too. Then when you're
Mm.
having that conversation with the person, you do want to validate their feelings. I didn't say agree with their feelings, but validate their feelings. I understand that you feel angry. I understand your point of view. I see where you're coming from. Then you can start to have a healthy dialect. Mr. Harris?
Brother Harris, did you catch the question or do I need to repeat it for you?
I picked up the last part of the question. I had to pick up the first part.
Okay, sure. So I'll repeat it. So you mentioned that it's normal to feel anger. If you are expressing shock,
Mhm.
disappointment, or dissatisfaction with someone's behavior, How can you effectively communicate displeasure without allowing the conversation to be derailed or deflected to a discussion about tone, energy, or attitude?
All right, yeah, that is a good question, and I think Dr. Perry did an excellent job in explaining how that happens. Now, here's one of the things, because I'm gonna piggyback on what she said, because sometimes I get complaints from clients sometimes when we're dealing with anger, and how to respond and how to react and more respond. But sometimes I get the response that, well, when you're angry like that, how can you stop just breathing? How can you stop and just da 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 da? But what she was talking about is really what needs to be learned. You got to learn how to come out of you, in a sense, come out of your feelings and submit, like she was saying, submit to that person's feelings and their thoughts and their opinions. It doesn't mean you have to agree with them.
It doesn't mean you have to agree with them. That's what we're picking back up once he comes back on. Okay, I see him.
Well,
Yep, there you go.
submit
Okay.
to their point doesn't mean you have to agree with it, but it
Uh-huh.
does mean that you have to validate that person's opinion.
Okay. So let me
This
add an
is
additional question on that. So when you say you should validate their opinion, like what if you just wholeheartedly don't agree? Like, okay, I can understand where you would be like, I see why you're upset, or I can understand your feelings. But what if you just don't agree? Like you think the reason that they are mad is completely like off, like you just don't agree. How do you handle that?
Well, that within itself is not necessarily a validation then. In other words, if I were to say, "Understand why you're angry," disagree with it, but I can understand why you're angry, or at least I can submit to your point of view, or I can at least see your point of view. That within itself is the validation, but I can also say I do not agree with that point of view, or I don't agree with that, but I can see why you're feeling that way. That helps a person to actually feel understood, which is actually a need of people.
Mhm.
People have a basic need to feel to understand things and to be understood. So all I all I'm really wanting is to feel understood. That doesn't mean that I have to be agreed with, but a basic need. I just want to be understood, but it's a need. And if that need is met, then I can handle you not agreeing with me on everything.
Okay. Um, okay, Dr. Perry, your thoughts on that?
So I 100% agree with Brother Harris what he said. So you don't, you just want to be under, you want to be validated. You can't tell me that my thought process is 100% crazy, because it's my thought process. So even though you don't
Yeah.
agree with it, you have to be able to, if you're having a constructive, not destructive, back and forth banter with a person, you have to say, I see your point of view. I don't necessarily agree with it, but I do see your point of view. Like today, like I'll give you an example. I came home, and I came home from work to let in a person who's working on my house, but my daughter was here, but she was asleep. I was so angry with her. I'm like, the only thing you had to do today was to open up the door. So I'm yelling and I'm screaming at her, and it wasn't getting anywhere. And she said, Mom, stop. Just please just listen. And she explained her point of view. I said, Taylor, I see your point of view. And when I told her that, instantly her whole demeanor changed for the positive. And I said, I see your point of view. However, baby, this is where mama's coming from. And the conversation shifted. See, I still started off with my slave parenting, right? But I had some point, I had to shift the conversation so we could constructively talk together. See, we're talking
Mhm.
about what is constructive versus destructive.
Mhm.
Constructive is building, right? Like construction, you build. Destruction is breaking down.
Mm.
So we want to build in the conversation. We want to build in the acknowledgement. We don't want it to break down.
That is real. That is real. Um, and even though I said I wasn't going to ask that question, you two just went ahead and just overachieving. See, just overachieving. Okay. The next question that I have from our one of our guests. So, Brother Harris, I'm gonna start this question with you. Don't we have a duty to ourselves and our families to be accountable and aware of our behavior and how it impacts others?
Yeah, absolutely. Yeah, we call that emotional intelligence. That's the ability to understand feelings, my feelings. I got to identify that feeling. I got to be able to regulate that feeling. I can even change that feeling, but I got to become responsible enough to do that. And not only that, but emotional intelligence also has to do with learning empathy, learning the feelings of other people, so that when I am dealing with someone, and I know this can be a really explosive, what I can do when I'm learning emotional intelligence is I can identify my own feelings, I can regulate my own feelings, but I also can empathize with somebody else's feelings so that now their feelings are not going to affect me in a negative way, but I am now able to I can't control anybody's feelings. I can't control their feelings, but I can definitely, as Dr. Perry was even given her example today about how she was upset and she knew she was upset, and then the way she talked to her daughter kind of reeled it back in. This is what we call emotional intelligence, and this is what many of us still need to learn how to do. Yes, I need to hold myself accountable for the emotions and for the feeling that I have, and for those thoughts that go along with the feelings, which is what causes us our emotions, or the ability to emote, if you will. Because a lot of my thinking and my feelings, they are connected with each other. So when I can learn how to just settle myself down, and Dr. Perry had mentioned something about the mindfulness, becoming mindful, and certain techniques, what we call the here and now, tell right here, right now, rather than me forecasting certain emotions and how they're going to respond and how they're going to do. And I'm getting myself ready. I don't even hear what they're saying, but I'm preparing myself for what I'm getting ready to say.
Right. Right.
Versus me saying, okay, let me identify what's going on with me, and let me get myself together, and let me kind of learn, if you will, or become familiar with these empathize. Let me empathize with these other people here, or whoever it might be. That within itself will help you to become more emotionally intelligent, which will then help you with the anger and hold yourself accountable and responsible for your own behaviors.
That was real. That was real. Dr. Perry, you want to add something to that?
So he pretty much hit the nail on the head from my perspective. And we have to realize that if we don't become emotionally intelligent, or at least dial it up, we will never have productive, successful relationships with other people.
Mm,
That's absolutely right.
mm, that
Whether
that
that's your kid, your spouse, your coworker,
Yep.
it's just not going to work out.
and you know what? I I'm gonna end with that right there, people. I think that that is the way that we end this. We could go on for hours talking about this because these two have just have blessed us with some nuggets, not only in the on the topic of anger management, but on the topic of life and how to live this life in, I ain't gonna say the best way possible, but to live it in as good a way as possible as we possibly can do so. Um, First, let me say thank you to you, Dr. Perry. Thank you to you, Brother Harris. You two have been amazing to converse with. This because this was not, like I said, this is just gonna be a conversation between me, you, and the rest of the crew. Um, I'm going to pass this off to our Director of Social Action, Brother Damon Sales, and let him give a few words. Brother Sales, the floor is yours.
Great job, Dr. Perry. Great job.
No, likewise, sir. Likewise.
Excellent job, both of you, and you too, Brother Mitchell.
Yes, sir.
Excellent job as moderator here. On behalf of our chapter president, Brother Eric Hill, he had a previous engagement he needed to attend. He couldn't make it this evening. So on behalf of President Hill, I bring greetings to all of you from the Omicron Sigma chapter of Phi Beta Sigma Fraternity Incorporated, the North Dallas Sigmas. And before I go any further, I see two men of Sigma that we need to acknowledge. On the call was our Gulf Coast Regional Director, Earl Gamble, and our Regional Director of Social Action, Frankie Lloyd. So I want to say thank you, gentlemen, for joining. I'm going to give you guys the 30 to 60 seconds if you want to say anything on your behalf. If not, then I'll continue and we can keep going.
Nothing from me. Awesome event. Panelists were great, very informative. I appreciate all this effort, everyone. Thank you.
Yep, same. Just echoing. Great conversation, great information that was given out. Some things to think about that people can take home, and that's what we do it for. So great job, guys. Thank you.
All right. Thank you, Regional Director Gamble and Regional Director of Social Action Lloyd. Everybody, we had some major gems drop tonight. I mean, it is what it is. And I know, I knew we'd get the realest of real words from both Dr. Perry and Pastor Harris. I've known Dr. Perry since we were like 10, 11 years old. Okay. We lived probably a quick skateboard trip away from each other.
Yeah.
So I knew what was about to happen tonight. And Pastor Harris came with the highest regard from a couple of different people. So it is what it is. And they didn't disappoint. Panelists, again, thank you so much. My guy Donald Mitchell, thank you for serving as moderator. Brother Mitchell has he's taken a lot of the load off me and running these seminars, constructing these seminars. So that is it's a good brother right there. So I want to say thank you, my guy, much appreciated. As many of you know, mental health awareness is something that our chapter, Omicron Sigma chapter, takes very, very seriously. So much that we upped our series coverage from 4 seminars in 2024 to 8 seminars in 2025. And tonight's session on anger management, it was part 4 of the 8-part series for this year. Our next session, part 5, will take place Tuesday, October 14th. Once again, Tuesday, October 14th. So put it on your calendar, same time, same channel, 7 p.m. Once, make sure you parents have your kids around for this one. We're going to focus on academic stress and family support. So you do not want to miss that one. And while I have you here, let me also add that you all, everybody, you all are cordially invited to register and or donate to our signature event, the Reginald Walston, R.R. Walston 5K Walk and Run. That's going to take place Saturday, September 6th at the Willie B. Johnson Center off of 635 and 75 in Dallas. This event benefits sickle cell awareness, and this year marks the 5th anniversary. I need everybody, if you've got Facebook, to go to the North Dallas Sigmas Facebook page. Again, North Dallas Sigmas Facebook page. We have all the information there. The donation page is there as well, and I can put that in the chat as well. September 6th, that's when we're going to have it. Look forward to having you.
Brother.
That being said, I now yield the floor back to our moderator, Brother Mitchell, as we prepare for this, or as we close this very important seminar on anger management. Good job, everybody. Thank you.
God bless you.
I'm gonna slide one more plug in. Brother Sales mentioned the 5K run and walk on September 6th, but we also have our 8th annual Frederick Love Golf Classic happening at the end of September. So if you're a golfer, if you know golfers, come out and help, just enjoy yourselves. It's going to be September 29th, 2025. It is going to be an affair you don't want to miss. Whether you golf or you don't golf, come out and hang with us. So with that said, thank you everybody for coming out tonight. Panelists, amazing job. I absolutely enjoyed it. And I can't wait to talk to y'all again. And guests, thank you for coming out. We hope that you picked up some of the nuggets that I picked up. And we will have this for review and to watch later if you would like to. Have a great night.
God bless you. God bless you.
God bless you.
Love you, Mari.
Thank you to the panelists, the moderator, and the director.